So now it's my opportunity to give you kind of a state of Authority Health. So 2019 was a year of transition for Authority Health. I was honored to become the second CEO in the history of Authority Health. I began my work just before we had the privilege of taking on the Popoff Family Health Center. And let me just give you some of that history. Dr. Popoff was a mainstay in the Detroit East Side neighborhood, so beloved that when he passed away, his widow rented a bus to bring his patients to the funeral. That's how much they loved him and honored the work that he had done on their behalf in the community. Shortly after that, Mrs. Popoff donated his practice to MSU, and MSU ran it for about 4 years or so. And it became a continuity clinic for our family medicine residents. MSU realized that they were having some difficulty trying to operate a community-based health center. Also, they have some other things that were distracting them and they were working on. But they certainly did not want to abandon the city of Detroit and that neighborhood. So they approached Authority Health and asked if we would consider taking on that health center and making that an Authority Health practice. And we indeed said yes. We did that. We have the practice, we have the building, and the property surrounding that. Why did we do that? Because those of you who know Authority Health know that a part of our vision is to make sure that we are key in supporting and protecting the safety net. Had that clinic gone away, that would have been a serious breach in the safety net for the east side of Detroit, where members who live in that neighborhood and love that neighborhood, have lived in there all of their life and plan to continue to live there, would have lost a mainstay, a clinic where they can leave their home and walk. And so we were privileged to be able to step in and fill that gap. In addition to that, I mentioned that we had been rotating there, our residents had been rotating there for the past 4 years. So it was also a primary site for our residency program where our residents could get a feel for working in a community, a resource constrained community, but that indeed had assets and has residents of that community that love that community. So we were very fortunate to be able to fill that gap. And I feel very fortunate to be able to step in at a time to lead that effort. In addition to that, we also rotate at Dr. Anne Marie Ice, her pediatric practice. Can I get a show of hands of people who have heard of Dr. Ice, know Dr. Ice, was delivered by Dr. Ice, or Dr. Ice delivered your children or your siblings? Dr. Ice is a legend in this community, and rightly so. She delivered half of us. She delivered our babies. She's trained a lot of pediatric residents in this community. And we had pediatric residents and still have pediatric residents rotating in her practice on the northwest side of Detroit, bordering Southfield. As happens many times, life happens, and sometimes people become ill, and sometimes they have difficulty recovering from that illness. And so, once again, Authority Health saw an opportunity to protect the safety net, to step in and to shore up the safety net as it relates to her pediatric practice. And so, we are very fortunate to be in a position where we are now the management company for Dr. Ice's practice as she continues to recover. And we have two physicians that are over there, and I will mention their names shortly. If I ever stuck to my script, it would be very scary. So I know I'm going to mention their names later on. But we are just very pleased to be able to step into that space to assure that that pediatric practice remains vibrant in our community, that our residents are able to train in this community, because we know that where you do your residency, you are more likely to stay. And so we are very excited for that. Also, early in my tenure, I was approached by Linda Little, who is the president and CEO of Neighborhood Services Organization. Many of you know that that is a renowned behavioral health organization and also participates in supportive and transitional housing. With NSO, we plan to achieve the highest standard of integrated healthcare, that being primary care, behavioral health, and supportive housing. So we are just at the cusp of that particular relationship. We're going to have integrated health at our pop-off clinic. We will be going with Linda Little and NSO over to their Westland clinic because we really want to make sure that we are in that space, that we're able to show people how that type of partnership and integration can occur. So we are very pleased to be stepping into that space. With the addition of primary care services, we needed to hire staff who knew that space, a healthcare executive who could provide the management expertise to guide the development of this process, to be able to work very synergistically with our residency program, and also to be able to provide the primary care administrative oversight. We were very fortunate to be able to recruit Mrs. Patricia White. You met her earlier. She opened up the program. She is our VP of Operations. Prior to joining us, she served as a health system executive at Henry Ford Health System. And Mrs. White, where are you, Patricia? All right, wave your hand so that we can say we are very thankful that she is here. Patricia is working with Dr. Ernie Yoder. Dr. Yoder, where are you? Raise your hand. And Dr. Chaya Pittman Hunt, who is the director of the Pediatric Residency Program and also has her hand very much in the Dr. Ice practice. Where are you, Dr. Pittman Hunt? She is doing interviews of our new residents. Okay, all right. So even though we're having a great meal and a program, you know, business goes on, right? And so, and that gives me the opportunity to say that every year we have about 20 new slots for new residents, and we get over 3,000 applications for those 20 slots. So we are a well sought after residency program. I would also like to introduce to you Dr. Allie Trippy, who went through our residency program, and she is now at Dr. Ice practice as a attending physician. And I don't know, is Dr. Casterline in the room anywhere? She is seeing patients. Yay, let's give a hand. Okay. She is seeing patients. And why am I saying give a hand? Dr. Casterline was graduating from our residency. Oh, there's Dr. Pittman, huh? Yeah, there we go. All right. And Dr. Casterline was graduating from our residency program just as I was coming in. Now, where did she come from, Dennis? Like California? She came from Texas, where everything is supposed to be bigger and better, right? It was her intent to return to Texas. However, once here, once being exposed to our population and the work that we like to do here at Authority Health, guess what? She stayed. She was hired by Authority Health, and she is working at Dr. Ice's pediatric practice. So in her absence, you can still give her a hand, and we'll let her know that you acknowledged her with a hand. Another important member of our staff who played an important role in the transition as we took on the Popoff Family Health Center, because you know that was no easy task, and that was Miss Kelly Herron. Now, Kelly came to us as a public health fellow, and she did some amazing work around the ACEs and around resiliency. And here at Authority Health, when we see talent, we try not to let you go. So we give you something that you may not have asked for and may not be prepared for, and we support you to do it. And so Kelly is our manager of community engagement. She was called into service to manage the transition from MSU to Authority Health of the Popoff Family Health Center. So Kelly was the either proud or unhappy recipient of all of my late night calls and all of my weekend calls as we made that transition. But she did a fantastic job with a complicated challenge. Thank you, Kelly Heron. Wave your hand so that people will know who you are. And then another member of our graduate medical education team who has taken on new responsibilities is Dr. John Seeley, and this is a name many of you know. He is the founding director of our medical education. He also serves as a consultant to Authority Health. It's important to have a physician who is experienced and respected as Dr. Seeley working with our program. He's not able to be with us today, but I do indeed want to mention the work that he started. And then, of course, Dr. Ernie Yoder has taken it on and has moved us to the next phase and the next level. So we want to, again, honor you, Dr. Yoder, for doing that. Now, I did mention that we have a couple of advisory committees, and I would like to recognize the co-chairs of the Community Advisory Committee, and I know I've seen some of you in the room, so don't be shy. First, I'd like to mention Mrs. Vonzell Brown Miller, who is the Manager of Community Outreach, the Office of Cancer, Health, Equity, and Community Engagement, Wayne State University School of Medicine, and Carmanos Cancer Center. Did I get it all? All right, thank you so much. She is one of the co-chairs, and then I don't know if I saw Dr. David Law. I don't think he's here, but he is a retired instructor at the University of Michigan Dearborn and the former executive director of the Joy Southfield Community Development Corporation. And he serves along with Vonzell as the co-chairs of the Community Advisory Committee. Now our co-chairs of the Provider Advisory Committee. I know Linda Little is not able to be here, but she is the president and CEO of Neighborhood Services Organization. And Dr. Kim Farrell is the interim executive director of Central City Integrated Health. Even though two of them are not here, can we please honor our co-chairs with applause? For those of you who have been around Authority Health for a while, you probably know that we were organized by the three local branches of government, state, county, and city. And in the interlocal agreement that formed us, two of the things that was mentioned that are a mandate for Authority Health, and that is to organize and convene the two advisory groups that I mentioned. So this is like the DNA of Authority Health. And so we really look to our co-chairs and to the members of those advisory groups to lead us, to guide us, to direct us, and to let us know what type of messages we need to be sending to the three branches of government that formed us. So these roles are very important. Now we also have a third advisory group, and this one was not mandated, but it is definitely vigorous and active and very opinionated, which I love. They have taken a stance where they want to be very strong in the policy space, and that's our Motion Coalition on Childhood Obesity. And I see heads nodding because you know how vitally important that is, all of our efforts around childhood obesity. And we are pleased that Dr. Carolyn Custer, who is our Director of Quality and Community Medicine for our GME program, agreed to also be the lead staff person over this collaborative representative of over 30 organizations in Wayne County. Now, they told me to be careful not to let my papers hit the mic, so now I've gotten that all out of the way. Dr. Carolyn Custer, wave your hand. Thank you so much for being the lead staffer there. Dr. Bill Dietz, who is a professor of Georgetown University in Washington, D.C., is one of the co-chairs. And then also Ms. Diane Valade, who is the manager of health policy at Henry Ford Health System, is the co-chair. And I know that she either is or was in the place. Diane Valade, where are you so that we can thank you for being a co-chair? She just stepped out. All right, perfect timing, Loretta. What can I say? Well, let's still. Now, this week, the Motion Coalition is putting action into their policy efforts. The Motion Coalition joined proponents of the 10 cents a meal program to send a message to Lansing in support of an appropriation to increase funding for the 10 cents a meal program. Now, 10 cents a meal provides funding to allow school districts to buy fresh produce from Michigan farmers. Unfortunately, this program is not scheduled to be funded in the supplemental appropriation that was agreed upon just this week. However, there is hope that funding will appear in a second supplemental bill in this January. So that means that we still have time to make our voices heard. And so these props are not just props. They're to let you know that the Motion Coalition has joined with others around the state, and they are sending plates to the governor with a message that says, "Save the 10 cents a meal program." We'll be delivering the plates on behalf of the Motion Coalition to the governor later this afternoon. Let's show our appreciation to the Motion Coalition for making their voice heard.